My name's Elizabeth. That is my Aunt Tere, my cousin Susie, my dad Eleazar, my mom Lupe, and my cousin Rocky. Do any of you guys know anyone that has been diagnosed with bipolar disorder?
Yes, I do, my English teacher.
I'm going to tell you a story about a boy named Jimmy. He was living his life for many years with bipolar disorder, but he was not diagnosed until years later. He would live depressed. Sometimes he would have mood swings. He would be happy. Then a few seconds later, he would be sad. He would skip school for no reason and come home, feel anxious. He wouldn't know what to do. He would experience suicide thoughts until years later, he was diagnosed with bipolar disorder. I am here to inform you about every cause about bipolar disorder. Bipolar disorder is important because you may not know a person right now, but you may know someone in the near future, and it's important to know the treatments and how to behave and help them efficiently. In this speech, I want to cover bipolar disorder, of course, its causes, effects, and how to treat it. The causes of bipolar disorder are very simple. Sometimes it comes naturally, sometimes it may not be genetic, or sometimes it is genetic. A family member that has bipolar disorder can pass it on to another family member. There's a 25% chance, so the chance is pretty high. The symptoms of bipolar disorder are anxiety. There's a lot of episodes that can occur. It can be a manic episode or it can be a depressive episode. A manic episode is more like anxiety. You feel very jumpy or high. Wired, you talk very fast about things. You are irritable or touchy. You can have trouble relaxing or sleeping. And the depressive episode are more about suicidal thoughts. You don't feel happy with your life. You're miserable and you feel like your life has no point. Bipolar disorder is very hard to diagnose, as I mentioned before. A lot of people can go on for many years and have it and not know that they do. Family and friends may not always see the person's symptoms as the bigger problem. A doctor may think the person has a different illness. That's why it's difficult to diagnose. Some doctors can diagnose this as depression rather than bipolar disorder, so it can vary. Bipolar disorder is treated by a couple different treatments. First of all is medication. To obtain medication, you need to go, of course, to the doctor, and there's different types of medication that can help. The doctor diagnoses you and he finds out what medication would be the best for you and how you would respond to it. Medications, the only unfortunate thing about them is that they can have bad side effects. Patients should always tell the doctors about their problems because it can affect their health, and the medication can actually do them more wrong than right. Another thing that can help is therapy. Sometimes people talking about their problems can ease the pain and can take away their feelings of anxiety or the feelings of depression or suicide thoughts. There's a lot of other treatments. Some people do not get better with medication and therapy, so there are other alternatives. There are different ways you can help someone that has a bipolar disorder. Some helpful things you can do is be very patient. Never rush a person or never pressure a person. Let that person come to you. Don't pressure them into telling you anything because that can make them more anxious. You can encourage your friend and tell them that you're there to listen, not really pressuring them, but telling them that you're there for them. You can be understanding about mood swings. Whenever they have mood swings, just be patient with them, as I stated before. You can include them in fun activities, get their mind off it. You can go roller skating, swimming, get their mind off the problems, and that can actually ease and make the treatment even better. You can remind him that there's always a treatment for them to get better and that they will have a successful life. If you have a bipolar disorder, do not hesitate to talk to your doctor. You should always talk to your doctor about your treatment, about how you feel the side effects are doing to your body. If you feel more depressed than happy, or if you feel that those side effects are not going away, if you still feel anxious and depressed. You should keep a routine for sleeping and eating. You should learn to recognize your mood swings and try to control them more often. Then it would come naturally. You should always ask people to help you, like a friend or relative. It's always better when you have someone by your side. It encourages you, it makes you feel better, and it gives you a lovable feeling. You can be patient about your own symptoms. Sometimes people also need to be patient with you, but the most important thing is to be patient yourself. So bipolar disorder can affect friends and family, not only yourself. Sometimes your family or your friends have to undergo all the things you are going through. You don't realize sometimes that it's harder on your family than it is on yourself, that they see you're suffering and that can affect them too. If you are taking care of someone with a bipolar disorder, always take care of yourself too. If you keep your stress level down, it will help you do a better job, and it will help to keep your loved one in the treatment. If you're not sure where to go for help, always call your doctor, always speak to a family member or a friend that you're close to. If you're thinking about hurting yourself, always call, especially your doctor. There's a hotline for the suicide. We have talked about bipolar disorder, the effects and the treatments, so it's efficient for us to learn them. So if we know someone that has them, we can help them recover efficiently. Like little Jimmy was having trouble undergoing his situation, we can also be there for someone else that's going through the same thing. Does anyone have any questions?
Yes, I have one. What is the toll-free suicide prevention lifeline?
The toll-free suicide prevention hotline is 1-800-253-8579. Does anyone else have a question?
Yes, is there an actual cure for bipolar disorder?
Unfortunately, at this time, there's not an actual cure. There are the treatments that I mentioned before. They're still working on the cure.
Okay.
My question is, can a person that has a bipolar disorder be suicidal?
Yes, like I mentioned before, a person that has a bipolar disorder can have a depressive episode, which means they can be suicidal and not want to live anymore and just be miserable for their entire life.
I have a question. Is it possible for people with bipolar disorder to have a normal life?
With the treatments and taking them efficiently, it is possible for a person to have a normal life and successful as well.
I have another question. If you are there for that person, would it be possible to help their condition?
Yes, love and friends and family always helps the person feel better and feel less depressed because he knows that people are surrounding him that love them.
My last question. So, is it dangerous for the person to be close to the person who have this bipolar disorder?
It's not dangerous to be close to them because, like I mentioned before, it can be a genetic factor. It's not a contagious disorder. It happens genetically or it happens naturally. You can always help the person be better, but that person cannot put you down to their level.
Okay.